Good morning and welcome to the Cuyahoga County Division of Senior and Adult Services third annual advisory board meeting. I'm Natasha Petricola, DSAS's interim administrator, and I thank you for joining us today. I'm so happy to welcome County Executive Chris Ronayne today as we share some wonderful updates about our division and our advisory board.
Good morning, everybody. It's Chris Ronayne, your Cuyahoga County Executive. Thanks for having me today at your annual DSAS Advisory Board meeting. I'm really pleased to participate with you, and I'm thankful for what you do. You know, the impact of the Division of Senior and Adult Services is big. I know sometimes you feel it goes unnoticed, but we notice, I notice. The goal is clear: help our older adults and residents with disabilities age successfully. I want to say to me, to you, this is personal. You know, when I worked in University Circle over the last 15 years, we worked with seniors to help them age successfully in place. We had a lot of seniors that had mobility challenges. We provided transportation. We made sure our infrastructure was suited for all forms of people moving around, whether they were walking or whether they were rolling in chairs. We were also mindful of the need to create healthy, vital, connected communities. That's what we did in one neighborhood of this great region of Cuyahoga County. But I want to thank all of you for your passion for what you do every day throughout Cuyahoga County and beyond to help our older adults age in place.
I'm really proud of the DSAS team. They do an excellent job providing in-home care, protective services, independent living services, and connecting seniors to resources that assist them with their daily lives. Our advisory board brings critical expertise from their organizations across the community with the shared goal to help our most vulnerable populations, which is what brings us to why we are here today. We'll hear about this year's progress and some of our successes from our board chair, Bill Hevel, and vice chair, Janet Keeler. We'll also hear from our keynote speaker, Emily Matillo, with the Center for Community Solutions. The Center for Community Solutions helped us assess the needs of older adults, surveying and hearing directly from the community. We are eager to share the first public report of the findings from the Livable Cuyahoga assessment phase. Thank you all again for taking the time to join us today. We have a great meeting planned and a wonderful host to guide us through the program. I want to welcome Robin Swoboda, our third-time host. Robin, you always do such an amazing job, and we are so glad to have you back.
Oh, thank you so much. I am so happy to be back. Thank you, Executive Ronayne and Interim Administrator Petricola, for your warm welcome and remarks. And I'm thrilled to be back. Thrilled that everything is up and running here, and the hamster wheel is turning on my aging computer. Speaking of aging, I want to thank you all for joining us for the Cuyahoga County Senior and Adult Services Advisory Board's 2022 virtual annual meeting. As they mentioned, I am Robin Swoboda, and I am pleased to be your host again. I always look forward to this meeting and the opportunity to share the great work that the county is doing for the older adult community. This year's theme, Livable Cuyahoga, on the path forward, will be taking a deeper look into the Division of Senior and Adult Services' new initiative to make our community more age-friendly, to better meet the needs of aging adults and adults with disabilities throughout Cuyahoga County. Today's program is graciously sponsored by AARP of Ohio, and we want to take a moment to thank them for their support. Our meeting will run about an hour and will include highlights of DSAS's work, how their programs and services have expanded, and some very, very exciting updates from the first phase of the Livable Cuyahoga initiative, which saw its launch this past year and will now focus on planning and the path forward. We invite you to engage with us by posting your comments and questions in the chat. We will be sharing resources and contact information after the event so you can stay connected. Again, welcome to all of you. We value your time. We value you. And we are so, so pleased that you are with us. You may remember last year, I had no hair. I had just come off of my chemotherapy. So now I have hair. It's brain cells that I'm missing. Chemo brain is real, but I thank you for bearing with me this year. And next year, God willing, I'll be even better. All right. The County Senior and Adult Services Advisory Board is comprised of 24 professionals who are making an impact on the aging and disability community through their current or previous work at various organizations. This group of leaders have years of expertise innovating and advocating for older adults and those with disabilities. They are at the forefront of aging services in Cuyahoga County, pushing for critical legislation, funding, and the development of programs that help support older adults and adults with disabilities have success and health. The board meets every other month to collaborate on shared goals and priorities and to host this annual meeting to share its work with you. At this time, I would like to introduce Board Chair Bill Hebel and Vice Chair Janet Keeler, who will give us an overview of the board and provide updates on their efforts over the past year. Good morning, Bill and Janet.
Good morning, Robin.
Good morning, Robin. Great to see you again. Thank you so much for being here with us.
Thank you. My pleasure.
All right. Well, again, good morning, everybody. Thank you very much for joining us for the 2022 DSAS annual meeting. As Robin said, my name is Bill Hebel, and I have the privilege of serving as the chair of the DSAS Advisory Board. As you'll see this morning, our board continues to be blessed with some of the most diverse professionals from so many fields, lending their expertise and passion to the mission and vision of DSAS. At last year's annual meeting, I'm sure you remember that we introduced the concept of the age-friendly community. Doug Tayak, one of our esteemed board members and Associate State Director for Outreach and Advocacy with AARP, was our keynote speaker that introduced this initiative to us. We are now pleased to announce that Cuyahoga County has been named an age-friendly community. We proudly announce the Livable Cuyahoga Initiative. Many of you joined us on September 15th of 2022 for the kickoff ceremony for the Livable Cuyahoga Initiative, which works to further the mission and vision of DSAS. As a reminder, the mission of DSAS is to empower older adults and adults with disabilities to age successfully by providing resources and support that preserve their independence. A means to ensure the continued success of this mission is through the Livable Cuyahoga Initiative. We've been working within our board committees to assist with the development of a survey that you will hear more about today. You will also hear more information about the focus groups that have been held to learn from our county's older adults what constitutes their quality of life. Our goal is to ensure that every person can be supported and remain independent, regardless of age or ability in their own communities. Our advocacy work has also continued through 2022. In line with our priorities, the advisory board has participated in several advocacy campaigns, including older adult safety and funding increases for adult protective services, combating food insecurity, and ensuring equal access to services for older adults and adults with disabilities. The advisory board also monitored and advocated for and against legislation that could have a detrimental impact on the Supplemental Nutrition Assistance Program, or SNAP benefits, to continue to be a leading voice in the fight to reduce food insecurity. And DSAS continues to advocate to strengthen supports for older adults by working to increase state funding for adult protective services. Through our efforts and with others, we have seen tremendous progress, now having the largest amount of state funding for APS in its history. We are enthusiastic about the upcoming budget and maintaining this momentum. I will now turn things over to my wonderful co-chair, Dr. Janet Keeler, and she's going to share some additional exciting things DSAS has in this from last year and into the coming year.
Great. Thank you so much, Bill. Thank you for the kind words, and thanks for sharing all that great information on Livable Cuyahoga and DSAS. So I'd like to share another great success with the audience today. DSAS, in partnership with the Metro Health System and the Western Reserve Area Agency on Aging, executed the 2022 Northeast Ohio Aging and Disability Summit at Tri-C's corporate campus. This summit was held on September 30th, and it was the first Aging and Disability Summit held in person since the COVID-19 pandemic. The theme of the summit was From Hindsight to Foresight, the Evolution, and some of the nation's most influential experts were present to discuss the evolution of treatment and care for America's fastest growing demographic. The summit provided a learning opportunity for many social workers and other professionals, as well as caregivers to aging patients or relatives. Over 300 people attended the summit, with 250 attending in person and nearly 70 attending virtually. By all accounts, this summit was a great success. Finally, in 2021, our board passed a resolution creating a position for an honorary DSAS advisory board member. Our board has been very fortunate over the years to have such dedicated and caring professionals supporting the mission of us. It was our intention that this new position honor the contributions of former board members and their continued involvement in the aging and disability space. This position is open to an advisory board member that served in a leadership role on the board, has the board's mission and vision, and whose involvement has made significant contributions to the aging and disabilities population. So today, it is my great pleasure to tell you a little bit about our 2023 nominee, Dr. Edward McKinney. Dr. McKinney was nominated by our current DSAS Advisory Board Chair, Bill Hebel, and we are proud today to recognize him as an honorary board member. Dr. McKinney has been a longtime member of the advisory board, most recently serving on the advocacy committee as a community member. He has served twice on the advisory board for a total of 12 years of service. His work in academia as a tireless advocate for older adults and adults with disabilities has made him a vital part of the advocacy committee's work. He worked on a major project with the Cleveland Clergy Alliance that resulted in an award of $300,000 to assist older adults and adults with disabilities to live safe and healthy in their homes. Dr. McKinney has been honored throughout the community for his efforts with older adults and adults with disabilities. Most recently, the Ohio Department of Aging inducted Dr. McKinney into the Senior Citizens Hall of Fame. He has also served on numerous boards, thereby broadening his influence and contributions to the people that DSAS serves. When we approached our board to vote on his nomination, the vote was a unanimous yes. So it is my honor today to present Dr. Edward McKinney with his nomination as an honorary board member, and congratulations to you.
Morning, colleagues. Thank you so very, very much. I consider it not a pleasure, but an honor to be part of such a tremendous organization serving seniors. I'm talking about the social activists, my colleagues, with the commitment of enhancing the overall quality of seniors, especially the growing older population. Let's not forget that this aging population will have many, many challenges. But thanks to organizations such as DSAS, there is hope. The organization DSAS, so honored, I feel so honored to become part of the organization that has demonstrated a commitment for enhancing the overall quality of seniors. I am thankful and just feel over enjoyed to have the opportunity to become part of this distinguished group of professionals, distinguished group, committed, as I indicated, to the general solution of enhancing the overall quality of seniors in our community. DSAS has done a tremendous job current, in the past, and you can expect the same to happen in the future. I am looking forward to being a member of the team, supported by DSAS. And my colleagues, I am extremely happy to realize that I may become part of such an organization. Thank you very much.
Oh my goodness. Thank you, Bill and Janet, for that wonderful review of the advisory board and the great work all of you do. And Dr. McKinney, I am speechless, not only from all the accolades, but your humility. And I think Angel should be added to that list. And I'm sure that Bill and Janet would agree. And just one quick question. What inspires you?
Well, I grew up in an area in South Georgia where there were many, many problems and issues. And I was introduced to groups and an organization that was focused on working with people that was having lots of difficulties. They encouraged me. I went on to grad school. And the purpose of going to grad school was to develop skills, knowledge that I could help people. And that has lasted with me, over the years. And that means helping people globally. I've spent several Fulbrights in South Africa, East Africa, all focused on working with people, and assisted in the development of an undergraduate program of social work in Southern Africa at the University of Botswana.
Wow.
That was way back in 2007.
Wait, yeah. And here you are in Cuyahoga County in Northeast Ohio. And I say for all of us, we are blessed to have you as part of the team, and just thank you for your service and your humility. You're a good man, Dr. McKinney. Come on over for some coffee sometime.
Yes. Thank
Okay.
you so much.
Thank you all. Thank you all. It's always so inspiring to hear from those who are working on the front line to get things done. It's so impactful for all of us. We can all learn something. It provides a greater understanding of all the work that you do. To take a step further, it motivates us to reflect on our roles and how we too can have a greater impact. With that, let's take a moment to hear from a few more members of the board as they share additional highlights and insight into their endeavors. Let's have a look.
First and foremost, we are so happy to have this strategic partnership with DSAS. Step Forward, a lot of the programs that we offer are really lockstep with what DSAS is trying to accomplish, with the 8 principles that DSAS has put together and the county has put together. Again, it really measures up and really matches what we are trying to accomplish in Cuyahoga County. One of the most recognized is probably our Home Energy Assistance Program, where we offer assistance to seniors in particular during summer crisis as well as winter crisis. Seniors have a hard time because of fixed incomes being able to afford their gas and electric bills. So that program services a lot of seniors on a daily basis. And it's great that DSAS understands the role that we play in the community and that they are willing to assist us getting the word out, especially for those crisis programs. We are constantly busy during those times of year. So we do appreciate the work that DSAS does to help inform the community. We do it as well, but obviously the county has a much larger reach. And doing that through DSAS helps us reach a lot more people.
The Cuyahoga Metropolitan Housing Authority and Division of Senior and Adult Services have shared a strong partnership for many years. CMHA serves more than 55,000 residents in Cuyahoga County and depends on partners like DSAS to help provide resources and services to those in need. We all know that DSAS supports seniors and adults in a variety of ways. As a board member, I am able to see firsthand the strong commitment and hard work that DSAS leadership and staff put in to ensure that seniors and others in the community are supported in helping them to lead healthy and safe lives. When you hear that nearly 400,000 people living in Cuyahoga County will be 60 years of age by 2030, you have to wonder, how will they be living? That is where the Livable Cuyahoga initiative comes in. This initiative is a passport to healthy living and aging. It will allow seniors and others to do more than just live in their communities. It will help them to thrive by providing activities and access to resources such as housing, transportation, health services, and outdoor spaces. I am very excited to continue on this path to a livable Cuyahoga.
Again, obviously, we already have a senior population in Cuyahoga County. Again, we service them at Step Forward on a yearly basis. But the sheer numbers that the county is projecting that we will have by 2030, it's hugely important that we continue to provide these services, especially for the senior-based population. But I also think it gives us, and our partnership with DSAS gives us the ability to be a little bit more strategic in our thinking, and the ability to kind of work together with the community partners to make sure that we are delivering the services that are needed. And if we're missing something, to work with those relationships within DSAS and the county, just to make sure that if we're missing something, that we provide those services or work to get those services to the senior population.
So many great words there. One of my favorites, though, is just reminding us that DSAS's goal is to help people not just live, but thrive in our older years, and that's what it's all about. They did such a wonderful job sharing their priorities and goals for their organizations and DSAS and the Livable Cuyahoga County Initiative. This is a great example of what successful partnerships look like. So many passionate people working together to make the community better for us all. Now, I would like to bring back the interim administrator for the Division of Senior and Adult Services, Natasha Petricola, who is joining us to share the efforts her team has made with the support of the advisory board. DSAS strives to make the aging process successful for disabled and older adults in our community. Their programs and services are essential to the aging population, especially as the number of older adults continues to rapidly grow. Though unlike many, but like my mom, I continue to get younger. But not really. Hello, Natasha. And I want to hear what you have to share with us. But first, I want to congratulate you on leading the charge and becoming the 665th livable community in the AARP age-friendly network. Last year, I know we began the discussion of making the community more age-friendly, and here we are a year later. So you are all off to a great start.
You know what, Robin, we truly are. We covered a lot of ground in a short period of time, and this is really exciting, because it feels like it's something new, fresh, and innovative. And to be quite honest, I don't feel we've had this kind of synergy and energy in a long time. This poises Cuyahoga County and the partners that this agency works with in a perfect position to continue to provide those services to a growing aging population and disabled adults. People don't realize oftentimes that we're at a point now that we're growing older than we are becoming younger. There are more people turning 60 than there are people being born or those under the age of 18. So, this is really planning for our futures, for everyone's futures, because when you make a county livable for older adults, you are truly making it livable for everyone. This will impact and bring positive changes to all the different individuals in our county. So we couldn't have come into this at a better time. we're really anxious to get the word out there, to share everything of the great work done by Community Solutions later on in the presentation with Emily. And then I just want to kind of recap a little bit about what our agency does shortly as well. So we're on the path forward, right? This initiative gives us, like I mentioned earlier, opportunity to really work with partners throughout Cuyahoga County, hear from our residents, and right size the programming that we need for people to age successfully. So what's important, and you're going to hear this recurring theme throughout these presentations that we're providing you today, is really our mission here at the Division of Senior and Adult Services. We are here to empower seniors and those adults with disabilities to age successfully by providing them resources and supports that preserve their independence. We have several core areas here and units that provide very specific kind of services to the older populations that we serve. We range everything from adult protective services, where we investigate allegations of abuse, neglect, exploitation, and self-neglect for those living in the community. But we also have an options program with a variety of programs that help people maintain their independence. We have a home support division with family service aides and nurses who go out and take the services directly into the homes of our residents throughout Cuyahoga County. We have an Office on Aging, which is where the Age-Friendly Livable Cuyahoga initiative is actually hailing from. And then we have our Aging Disability Resource Center, and they are the ones that we affectionately call our Information Services Division. They help those seniors without protective needs with some short-term case management. This all gets done, through our Connection Center, which is where people call in to receive the services. And the reason we're really talking about all of this today is because the needs of older adults is truly growing across our county. Alone, if you look at the number of the Connection Center calls that we've received, you can see a tremendous increase, a 40% increase between 2021 and 2022. So there's almost 19,000 calls we received in 2021. In 2022, we almost hit 27,000 calls through our Connection Center of people looking for resources, supports, services, and DSAS-specific programs to help them either remain in the community or just to get some additional needs met that, right now they're not able to do independently on their own. We also have a web portal where people are able to access our Adult Protective Services program, and we've seen nearly a double increase almost in calls, and then, not calls, but that referrals coming in through that web portal, where we have people making reports on allegations of abuse, neglect, and exploitation for older adults residing in our community. So you might want to wonder where all these calls are going to. Here's kind of a chart that breaks down what kind of things we're receiving from the public on a daily basis. So if you look at 2020 results, in Adult Protective Services, we had a little over 4,000 reports received. We had 144 home support calls that we took and enrolled people in our home support division. In our Information Services, our Aging Disability Resource Center, we had about 2,500 reports that we received and referrals made. And then our Options program, almost at 2,000 reports received from the community. Our agency reports and referrals have increased 30% from the previous year. And, we see oftentimes our seniors are calling and disabled adults are calling in for integral programs and services that we help connect them to. Programs such as SNAP that, really heavily looks at food insecurity and provides substances as far as additional meal and monies towards food. We also have our HEAP program. We know that housing has been a huge issue more recently with the cost of inflation kind of impacting across all different realms, the different services and goods out there that people need to just maintain and remain independent. And we also know that we've had a lot of external referrals where we also connect people to services outside of DSAS. If it's something we're not able to provide, our Connection Center staff are equipped to provide those resources and make those necessary connections. So if you look at our active cases, there's growth here as well. So between 2021 and 2022, we see that we had about 5,800 reports in our programs and active clientele. We're almost at 8,000 individuals that are either in our Adult Protective Services program that have been somehow serviced. We have our Home Support Division again, our Options for Elders, and our Information Services Unit. And so even just shortly after looking at these brief numbers from year to year, some of it we're starting to wonder if it is the residual effects of the pandemic. But we also realize that times have changed and we may never go back to the normal or what we knew prior to the pandemic. So it's very necessary for us to really keep an eye on the trajectory of what our public is looking for as far as in terms of services. If you look at the active cases broken down in each of our DSAS programs, this graph kind of connotates those different individuals and those programs. Options for Elders, again, a little over 2,100 clients are actively being serviced in those programs. Our Home Support Division is just under 400. Our Information Services, we have two different programs. We have one that actually goes and does case management and sees individuals in their home that are disabled or 60 and older. And then we have a division of that program area that really works with the senior centers and our partners out there. And that relationship is just so valuable. You have no idea, just being able to take services directly to an individual in their community and being able to go to homes and really get a perspective of what people may need. And then again, our protective services through APS, which is about 2,300 new cases that we received in 2022. So we are here today because we are, again, preparing for an aging Cuyahoga. The state of Ohio in general, all 88 counties are pretty much in the kind of same predicament that we are in. And that's not necessarily a bad thing. It's a blessing to grow older. And so, again, like I mentioned with Robin, we've kind of hit that tipping point where we are growing older than we are becoming younger. We are seeing more people aging to the 60 kind of population than we are seeing those that are 18 and under. So we know that people in Cuyahoga County, 60 years of age or older, currently it is about 319,264 individuals. That constitutes 25.8% of our total population. And we know by 2030, this is only going to grow. We know that 30% of our total population by 2030 will be 60 years of age or older. So the time is very relevant right now to forecast what we need to ensure people can age successfully in their homes, in their communities, and in place. The cost of residential care is so much higher than it would be to wrap around services and programming around older adults and those with disabilities. You're going to hear much more about the domains of livability, but the way the AARP set up age-friendly communities is they looked at 8 core areas of concern that really needed addressing, and that should be something at the forefront of all of our missions when we're servicing people in the community with a variety of needs. Many of these are common and they transcend different age groups. So I don't think it's anything out of the ordinary for us to kind of look at each one of these and be able to logically say that if we can fine tune and fix certain kinds of domains for one age group, I think that the effects of those programming and the effects of giving attention to these areas will really help other people as well that are younger than 60 or are not disabled. So we have obviously communication and information, being able to share on a variety of methods and distributing that information in ways that residents can utilize it. We have community and health services. We have several wonderful healthcare networks in our area. We're very blessed to have those. And I think that accessibility to healthcare is one of those issues that we have to look at, not only those that have the ability with the insurance provided to get that kind of access, but also marginalized communities that may need some resources and help getting to that point. We have outdoor spaces. We look to have walkability, sidewalks, things where people can easily access bus routes, just get out there and enjoy spending time with others. Socialization is huge. And we really learned that during the pandemic that one of those key areas that we saw some decline in just people and their ability to thrive was when they were kind of isolated and didn't have that openness to communicate with others. Transportation, housing, social participation, respect and inclusion, and civic engagement, those are all self-explanatory domains. And as Emily does her presentation, you'll hear a lot more about what our residents in these smaller focus groups, through surveys and through a virtual town hall, really identified as things that they felt were needs that maybe we need to put more energy into, or we just don't have it correct at the point of this time.
I'm speechless. I'm speechless, Natasha. You put it all together so well and just wrapped it up in a big bow. And
Thanks.
so much is being done on behalf of our seniors and those with disabilities. And I can't think of a better place. I can think of better weather, but I can't think of a better place to live than Cuyahoga County if you're 60 and above or disabled. So thank you for that. Now we have to move on to our highly anticipated keynote address, where we will hear for the first time the results of the first stage of Livable Cuyahoga initiative. After joining AARP's network of age-friendly communities and launching the Livable Cuyahoga initiative in September of last year, DSAS, at the direction of the Center for Community Solutions, completed a comprehensive needs assessment of the community. Through the surveying and focus groups, they gathered critical input from the residents across Cuyahoga County. Our keynote speaker, Emily Matillo, who serves as the Director of Research, Williamson Family Fellow for Applied Research at the Center for Community Solutions, leads the, that's hard to put on a business card, leads the assessment process of examining the concerns of older adults in our community. Emily has an extensive career in research and has long examined health, social, and economic conditions. She has both public and non-profit, including her previous work, age-friendly communities. Good morning, Emily, and welcome to you. It's your time to shine.
Good morning, Robin. I'm so excited to be here.
We are so excited to have you. So fill us in.
Great. Well, I am excited to be here to share with you the results of the Livable Cuyahoga assessment, which really has been a year in the making. We have had the opportunity to talk to well over 100 older adults in the community. We surveyed heard back from surveys from nearly 400 older adults, and now we are able to share those results with you today. As I mentioned, this opportunity to share the Livable Cuyahoga Needs Assessment has been a year in the making, and I'm beyond excited to be able to share some of the results of the needs assessment. We learned so much about our community, and today I have just time to share a few highlights, and so I highly encourage you to visit the Cuyahoga County website for the full report, which will be available immediately after our meeting today. As Natasha mentioned, Livable Cuyahoga focused on 8 distinct areas of our community. We refer to these as the 8 Livable Cuyahoga domains. Today, I'll share key findings that relate back to each one of these domains. For each area of focus, I'll share the attributes that make a community livable, the key findings of our assessment, and the data that support our key findings. As we go along, please put any questions you have into the chat and we'll do our best to answer them. Our first domain is community and health services. A livable community has well-distributed health and social service locations, health services integrated into residential areas, coordinated delivery of services, choice of service providers, a well-trained workforce, and emergency planning that includes older adults. In Cuyahoga County, our research found that the highest incidence and rates of disability among older adults within the county occur in the city of Cleveland. We also found that access to doctors and hospital visits are high, but other barriers to health do exist. We also found that Black and low-income residents are more likely to rate their mental health as fair or poor. This chart demonstrates the rates of disability for adults over the age of 65 in Cuyahoga County. You can see that Cleveland has a higher rate at 42% than both the inner and outer ring suburbs. 76% of residents can get appointments when they need them. 19% can sometimes get appointments, and just 5% are not able to get the appointments when they need them. In focus groups, we heard directly from residents that some of the barriers they face when accessing care, including feeling like their providers or doctors are not listening to them, feeling frustrated that their provider is treating them differently because they have Medicare, feeling rushed during medical appointments, and leaving appointments confused. In general, older adult residents of Cuyahoga County rate their mental health higher than their physical health. Mental health was rated good or better by 90% of residents, whereas physical health was rated good or better by just 78% of residents. When we look at the data a little deeper, we do find differences among groups. Black residents are significantly more likely to rate their mental health as fair or poor compared to their white peers. Another thing we see is that lower income residents, those with incomes less than $30,000, are more likely to rate both their physical and mental health as fair or poor compared to their higher income counterparts. Next up is outdoor spaces. When we consider outdoor spaces, a livable community has clean and well-lit public spaces, green spaces, walkways, and cycle paths, ample outdoor seating, well-maintained pavement, roads accessible to both pedestrians and motorists, traffic enforcement, accessible buildings, well-maintained public restrooms, and services clustered near residential areas. Through our research, we found that well-maintained sidewalks are connections to the community, that parks are highly valued by older adults in Cuyahoga County, and that safety is top of mind. Sidewalks connect people to their communities and are crucial for pedestrian safety. Over a quarter of residents do not have access to sidewalks in good condition, and over 40% do not have separate pathways for pedestrians. Nearly 2/3 do not have plowed sidewalk during the snowy and icy months. We asked people what they like most about where they live and also what they hope to change. We heard from many residents that were grateful for walkable neighborhoods. They love the trees in their neighborhoods, the proximity to Lake Erie, and the changing seasons. And I think in every single focus group, we heard about people's appreciation of the Cleveland Metro Parks. Safety was a common issue discussed in focus groups, and we heard desire from the community to have both more and more effective police. Older adults also shared that a desire for having less guns in their community and having better street lighting, and those two things would improve safety. When we consider transportation, the following attributes make a community livable: affordability, reliability and frequency of public transit stops at key travel destinations, specialized services, priority seating, courteous and competent transport drivers, accessible, convenient, and safe transport stops and stations, easily accessible transportation schedules, availability of rideshare services, well-maintained roads and highways, priority parking, and affordable parking. Our research found that cost and access to safe transportation varies by municipality. We also found that getting around the county is easy for those that drive, and increased access to medical transportation is desired. Using the AARP Livability Index, we were able to look at each municipality or village in Cuyahoga County and compare the household transportation costs. This chart here shows the communities with the 10 highest and the 10 lowest transportation costs. Also using the AARP Livability Index, we identified the communities with the lowest and highest fatal crash rates. One thing to note is that the communities with low rates saw a decline in their rates from 2015, whereas communities with the high fatal crash rates saw rate increases over that same time period. Of course, there's more to transportation than cars and car safety. Our survey results found that 2 out of 3 residents have access to safe pedestrian crossings, 3 out of 5 residents have access to protected bike lanes, and 1 out of 3 residents have access to bike lanes that connect locations. 81% of older adults living in Cuyahoga County report no problems getting around for appointments, events, or general locations. We found that 85% of residents drive, 36% walk or use a mobility device, and 28% are driven by friends and family. Just about 10% of older adults in the community are using public transit on a regular basis. While medical transportation may be available to some, it is often seen as inconvenient due to long waiting times for riders or miscommunication with service providers. Residents in Cleveland Heights shared that they wanted to see more options for medical transportation that take you to main hospitals downtown or the new Metro Health facility nearby. Participants with language barriers expressed that they find it difficult to arrange transportation for appointments. When we think about housing, we think of places that are affordable, well-designed for changing mobility, all-weather comfort. We think about financial assistance for home modifications, home maintenance programs and services, options to age in place, community integration, range of housing options, and safely constructed structures. Our research found that older adults in Cuyahoga County wish to remain in their home as they age and in the county as they age. Renters experience higher housing cost burden than homeowners, and residents needing to move or modify their homes to meet mobility needs will need assistance finding the right housing fit. 96% of residents want to remain in their homes as they age. 80% want to remain in the county and 83% in the region. Renters experience higher rates of being burdened by housing costs than homeowners in the county. Those experiencing housing cost burden are paying more than 30% of their income towards rent. We found that older adults in the outer ring suburbs experience the highest rates of being burdened by housing costs. About a third of residents feel confident that they could find housing if they needed to have alternative housing to meet their needs. When we look at specific populations, we find that this rate is even lower in older adults who earn less than $30,000 and among Black older adults. The past 3 years have created both new challenges and opportunities for older adults wishing to be social. A livable social scene includes accessible events and activities, prioritizes affordability, has well-promoted activities events, addresses isolation, and fosters community integration. Our research found that 30% of residents lack companionship. Older residents are most interested in socializing at restaurants, museums, and libraries. And adults between the ages of 50 to 64 are less likely to socialize with friends and family than those aged over 65. More than a third of older residents in Cuyahoga County sometimes or always lack companionship, and about the same percentage feels alone. Being active in the community can reduce feelings of loneliness and social isolation. Dining out, visiting museums, and libraries are top 3 activities older adults in Cuyahoga are interested in participating. Over 80% of residents are socializing daily or weekly with friends and family. Just under 10% are hardly ever socializing. When broken into age categories, the younger older adults report socializing less frequently than those over the age of 65. We also see that lower income residents, those earning less than $30,000 a year, are socializing less than their higher income peers. A community that shows respect and social inclusion to its older adults will have respectful and inclusive services, positive public images of aging, intergenerational and family interactions, opportunities for lifelong learning, community inclusion, and economic inclusion. Our research found that residents aged 75 and older report feeling more respected than those in younger age groups. Having knowledge and awareness of community events is the top way to feel connected to the community. And lower income residents are significantly more likely to feel disconnected from their communities. 1 in 4 residents disagree or strongly disagree that older adults are treated with respect in the community. When we examined being treated with respect by age, we found that adults over the age of 65 are significantly more likely to be respected than those between the ages of 50 and 74. 1 in 4 older adult residents feel disconnected to their community. The best way to feel more connected is by increasing the knowledge and awareness of things to do in the community. This was reported by 45% of the older adults we surveyed. 35% of residents with lower incomes feel disconnected compared to 23% of peers with incomes over $30,000. Working and volunteering and staying engaged civically also keeps older residents socially connected to their communities. A livable community has a variety of volunteer options, well-organized and accessible volunteer options, a range of employment opportunities, job training programs for older adults, accessible work and volunteer spaces, opportunities for civic participation. These communities value older adult contributions and support entrepreneurship and offer fair pay. We found that older adults seeking work in Cuyahoga County face barriers related to ageism and technology. Most residents plan to stay in Cuyahoga County part or full-time after they retire, and voting accessibility is impacted by both race and income. The most common barrier selected for not being able to find work was related to ageism. 46% of residents indicated that employers won't hire me because of my age. A quarter of those who have struggled finding work report struggling with technology on the job and the applications to get the job. Upon retirement, most, 75%, of residents intend to continue living here in Cuyahoga County year-round. Just under 20% will live here part-time, and 6% plan to move out of the county. Over 80% of residents report having accessible voting locations. However, Black residents report less access than their white peers, and low-income residents report less access than their higher-income peers. A livable community has well-functioning methods of communication with older adults. This includes universal system of communication that can reach all, communication available in multiple languages, coordinated information and dissemination, printed information that uses large text and high contrast, plain, easily understood language, limited use of automated communication, and wide public access to high-speed internet. Our research found that finding information on services is less accessible for Black residents and residents between the ages of 50 and 64. We found that a majority of older residents do have access to a computer and high-speed internet within their homes. And communicating with friends and family is the most common use of the internet among older adults. Older adults find services primarily through the phone, websites, and through word of mouth. Only 2% are rarely or never able to find the services they need. 72% can find information on services all or most of the time. However, residents between 50 and 64 and Black residents have lower rates of finding information than their peers. Access to broadband internet and computing devices is highest in the outer ring suburbs, slightly less in the first ring suburbs, and lowest in the city of Cleveland. The most common use of the internet among older adults in Cuyahoga County is communicating with friends and family, followed by banking and reading or watching the news. Today, I've shared just a few highlights from each of the livable Cuyahoga domains. I'm sure that this has piqued your curiosity, and I again encourage you to check out the full needs assessment findings to learn more about the needs and interests of older residents of Cuyahoga County.
Thank you so much, Emily, for that insightful report on the results of the livable Cuyahoga assessment. It's quite enlightening to learn how the older adults in our community actually feel about the current state of aging in Cuyahoga County. And there is an overall positive, hopeful sentiment about our community that I too share. I think you would agree with me, and I'm very excited about the enhancements that these initiatives will bring to our community to make it a more equitable place in which to age successfully. And I must add, you seem to have left no stone unturned
Thanks, Robin. Yeah, it's a lot of information to get through quickly, and there's even so much more in the full report. I
Oh,
just really touched on what we have. So we have this wealth of information about our community.
yeah, so
I have
impressive.
I have no doubt it will be used well into the future.
Absolutely. Good job. Great job. All right. Thank you. Thank you so much. Now we will hear from someone else who's very special, a very special guest, Representative Chantel Brown, joining us with a timely message about the action being taken legislatively to support our growing, aging, and disabled population. Please welcome Representative Brown.
Hello, everyone, and welcome to the Cuyahoga County Division of Senior and Adult Services virtual annual board meeting. I am Congresswoman Chantel Brown, and I am proud to represent Ohio's 11th Congressional District. A Clevelander, born and bred, it is easy to work every day to ensure everyone in our county has access to all available benefits and opportunities. That is why one of my top priorities in Washington is to advocate for our seniors and for improving their quality of life. For example, Medicare serves as a lifeline for seniors and provides health insurance to over 60 million older Americans, and I am committed to protecting and expanding access to it. That commitment made it easy to support significant measures passed in the House of Representatives during one of the most productive Congresses in recent memory, the 117th Congress. For example, the Inflation Reduction Act delivered historic results for our nation's seniors and expanded access to Medicare. And Ohio seniors are already seeing results from this legislation through lowering and capping drug prices while expanding access to key life-saving services. The Inflation Reduction Act will save billions of dollars for seniors and people with disabilities by granting Medicare the authority to negotiate drug prices. Additionally, the Inflation Reduction Act provides free vaccines to adults in Medicare Part D and Medicaid. And starting January 1st of this year, the IRA caps out-of-pocket insulin costs at $35 per month for Medicare Part D beneficiaries, saving thousands of Ohioans on high drug costs. In 2025, the IRA will continue to deliver for seniors by instituting a $2,000 annual out-of-pocket cap on Part D prescription drugs. And for the first time, all 1.9 million Ohioans with Medicare Part D can rest assured that the cost of their medications will be capped. Let us hope the 118th Congress will be able to build on this progress and develop more ways to lower costs for seniors. It is also imperative that seniors continue to receive their Social Security benefits. The Social Security 2100 Act introduced in the last Congress would expand benefits for current beneficiaries and strengthen the Social Security system for generations to come. The 118th Congress has an opportunity to build on this legislation to deliver more meaningful results for our seniors. There are many of us in Washington who will continue to work for bipartisan solutions to deliver results for seniors in Ohio and across the country. I'm pleased to share, as part of the government funding package for fiscal year 2023, we passed last month $23 million of community project funding requests I made for Northeast Ohio were included. These funds will support programs to improve the quality and longevity of life in Cuyahoga County, such as investing in hospitals to provide better care, improving our infrastructure, which will make our community safer. With these investments, we will revitalize Northeast Ohio for all who call it home. As a native Ohioan and coalition builder in Congress, I remain deeply committed to representing the values of our community to deliver for our seniors and for our community. Thank you.
Oh, thank you. You are beautiful outside and inside. And I'm making a notation to make sure that I get Medicare Part D. For sure. Thank you, Representative Brown, for highlighting just how important it is that we prioritize our older adult and disabled community, and for sharing that very exciting update about your efforts to secure funding to support our community in Northeast Ohio. This morning has been filled with so many thoughtful speakers and announcements. We've heard from those who are taking action to ensure that our community is a great place to live and grow older, but it is just as important to hear from those who are impacted by the work, those who are aging in Cuyahoga County. Our final video showcases the different challenges of older adults who are aging successfully in our community, and they are quite inspiring. I think you'll agree. Let's take a look.
For 80 years, I've lived in Cuyahoga County. I was about 3 years old when I came to Cleveland.
I live in the community of South Euclid, and I've been here for 27 years. As long as I can maintain my home, I would like to remain there, and I love it.
Cuyahoga County has so many advantages. It's a small city feel, but it has the big city orchestra, baseball, football.
But right now, I'm enjoying my stay right here in Cuyahoga County.
I believe family is important, just like I believe the community is important. One thing about our community, we have a real good senior center. And now some senior centers will pick you up, like our senior center will. They had a bus that will come to your house and pick you up and bring you to the senior center.
So I enjoy life. I enjoy this latter part of my life. I'm just stimulated to remain active. And not because I don't have aches and pains, but because I want to keep moving. I want to keep it going.
Livable Cuyahoga has neighbors looking out for neighbors.
I know that my children feel that I should probably be in a smaller dwelling, but I've demonstrated to them that I can handle being independent in my home.
I'll probably be here till I leave here or somebody buy a house for me, because I don't plan to buy another house. I plan to keep this one up, and I plan to keep it senior sized. Whatever I need, like I had that light put in the kitchen, and I'm gonna have some bars and things put up. And I plan to be here until I'm not here.
I want to live in a community where everybody feels comfortable. People can get together.
Continuing to be engaged in activities with other people. Interacting is very important with others because it benefits you as well as it benefits the other people.
I made some new friends at the senior center playing bridge.
We really need to engage every age so everybody feels important. Everybody is happy. Thank you, Livable Cuyahoga, for being here for us.
I am Livable Cuyahoga.
Because if you're not participating and being livable, you're not enjoying your life. So Livable Cuyahoga is trying to get you to live and enjoy your life.
It was so wonderful to hear from Gwen, Pamela, and Mary about their perspective on aging in Cuyahoga County. What exemplary examples of aging successfully and participating fully. I think we can all learn a thing or two from those ladies. I know I can, and they certainly inspired me. The impact of DSAS is far-reaching, and the Livable Cuyahoga initiative is yet another way the agency is impacting the lives of older adults and ensuring that we all have the opportunity and access to participate in community life. Now, Natasha, I want you to join us again and share with us how we can stay connected and how we can all get involved with DSAS and the Livable Cuyahoga initiative.
Thanks, Robin. So where are we at right now and where are we headed? If you look at our next step slides, this kind of outlines what we've done so far, and we're at the very preliminary stages of this, and where we're kind of going with this entire initiative. The key here is to remember we are all in this together. We are one community. And like the ladies stated in the little video of our seniors, it really shows that they are committed to the communities they live in. They enjoy the resources that are around them currently. But what is that added little touch that we can add just to make sure that everybody feels that supported? So, as we had mentioned earlier, we started this whole endeavor in April. We became the 665th age-friendly community in the nation on April 14th. So we're just easing out of that phase, which was our assessment phase. Emily shared all the results and data that came out of the different surveys we had done and the community focus groups. So that assessment now is completed, and we're going to make sure that everyone on this meeting today, as well as our other community partners that we interact with, have the results of that survey and a final report. Now, looking forward, and this is where we really have to join forces. This is us working again across different agencies, across different communities, to really fine tune in each one of our areas what the people in our communities require to age successfully. So we're going to start the planning phase now in 2023. Each one of these kind of phases take about a year to kind of accomplish. As I said, we joined the network in April. We got through the assessment phase. That's kind of year one. Our planning phase is going to start hopefully very soon. We're looking at consultants and other people that we can draw into that, kind of a high-level advisory group who will provide information that they feel is relevant from their respective domains to kind of keep us very much focused and on target. Once we get through the planning phase and we kind of set in motion where we want to go with this, we work towards our plan implementation and evaluation phase, which are year 3 and 5. That's when we actually start connecting with those in the community, looking at the various centers of excellence to draw them into this and really bridge and plan out what we plan to do with the whole livable Cuyahoga. And then our last step is the continuous cycle that we're going to be doing throughout this process once we've kind of reached the pinnacle of it. And that's always reassessing where we can make improvements, kind of looking at where we have to broadly build out more or where we have to fine tune things a little bit closer to what we might need as far as what the community has talked about as needs. So I want to mention how people can stay connected with DSAS. We cannot do this alone. If I can stress anything today, is that this is kind of the foundation or the groundwork about where we are headed with this entire initiative. So we have centers of excellence here at the Division of Senior and Adult Services that do very specific kind of things with those in the community. But all of those of you today listening and participating in this, you too have an expertise that you can bring to the table. So make sure that you sign up for Livable Cuyahoga updates. The link is provided right here, and you can learn more about the initiative, the advancements we're making, and any of the leeway that we do in some of this groundwork. Learn more about DSAS programs. Actively, you have people out there seeking resources. Make sure you call our Connection Center. They can either connect someone to programs that are internal to DSAS, or we provide the resources that people need outside of our agency to work with those in the community and partner agencies to provide those seniors those things that they need, and disabled adults as well. So those are the web addresses and the number to our Connection Center. And we really hope that, we gave you some insight into where we are headed with this initiative today.
Boy, you sure did. Perfectly stated. And I think we're all leaving with today's meeting so inspired with a greater understanding, but the resources DSAS provides to the aging and disabled community to empower them to preserve their independence and live their best lives. And we're thrilled about the next steps in Livable Cuyahoga's path forward. And you've laid it out. All stones have been turned over. And any final thought other than get to it?
No, I like that whole mantra. Get to it. So, like I said, we are all in this together. I almost sound like I'm on some kind of sports team campaign, but it's relevant. We can do it for the Cavs and the Browns and the Guardians. So let's get to it here as well.
Exactly. Let's go, Rudy. All right. Thank you so much. And I hope I wasn't too crazy, because I've had my little daughter. She used to be named Millie Vanilli, but now she goes by Betty White, because she's got a sassy little attitude, and she was licking my hand practically the whole show, keeping me comfortable. So I must say that's a wrap on the 2022 virtual Cuyahoga County Senior and Adult Services Advisory Board meeting. We appreciate you taking the time to be with us today. The advisory board and DSAS leaders hope you leave today with great awareness, with a greater awareness of the work that they do and the services they provide. A very special thank you to all of today's presenters, and a huge thank you to our sponsor, AARP of Ohio, for their support. We appreciate you for sharing your expertise and vision with us. Now, finally, please leave comments. Continue to leave them in the chat box, and we will follow up with you. And remember to keep an eye on your inbox for DSAS's 2022 annual report in the coming weeks. Following this meeting, we will be sharing the community needs assessment referenced in Emily's address, and it will also be made available on the Livable Cuyahoga website, livablecuyahoga.us. I'm Robin Swoboda. These are my friends all over here. We can't thank you enough for joining us today. Have a wonderful rest of your day. Goodbye, everybody.